Hello and welcome back to GP Video Podcast by Nadia. So today the topic that I'm going to touch upon is a very general topic, and I might have some ideas that might not align with what you guys think or with what the other health professionals think, but it is one of the issues of our general practice these days, and that is, should I Google my symptoms or not? Should we use Dr. Google or not? What are the pros and cons? So basically, everything in this world has got pros and cons, all right? So if I just say that, oh, you should not Google your symptoms at all, you should just, if you have any medical symptoms, you should just go and see your GP straight away and stuff like that. Of course, it is not going to be absolutely true because, yes, it is good to be aware of your symptoms and Google, yes, it tells you a lot of stuff, a lot of correct stuff as well, and it's good to be self-aware of the symptoms before you go and see your doctor. And because these days it's very hard to get hold of GPs on time, it is good to see what you are suffering from and what do you think it could be. But in my personal view, the cons outweigh the pros. You might think the other way around, but I literally think that cons outweigh the pros. But anyways, I want to keep it very neutral, and I want to open a discussion here that whether we should Google our symptoms. Okay, Googling is one thing. Then believing them all over and then not listening to the doctor but not obeying or practicing what he or she is teaching or giving us is another thing. So, I would not want to put my ideas here. I would want to read a few things for you guys from different articles that share about pros and cons of Dr. Google. So basically, before I read those articles for you, I would like to say that people who have got a lot of anxiety about their health, it's good for them sometimes to refrain from Googling, because what happens is whenever you Google something, Google is going to start with the worst most scenario first. So for example, if you're going to write down your symptoms and you're going to Google it, Google is not going to say, don't be stupid, you do not suffer from anything, you're all absolutely fine, just go and see a doctor, don't come here, don't talk to me. No, because that's not the case. What if you're really suffering from something? So just joking. No, the thing is that Google is going to tell you the worst scenario first, and then after scaring you and all, then at the end they will say, please go to your GP, go to your health practitioner, go to your health provider and get the diagnosis and get the treatment and whatever they would say. So if people who have health anxiety, if they refrain from Googling their symptoms, that will be great. And then the other thing is, when you're Googling the symptom and then you come up with the diagnosis, you just go and talk to your doctor. You just start with, oh doctor, I think I'm suffering from plantar fasciitis, without telling your symptoms to your doctor, because you just then automatically you forget about them, because what you've done is you've put all your symptoms in the Google and you've come up with a diagnosis, and when you're going to tell the doctor, you actually automatically have forgotten what was the chronicity of your symptoms, when did the symptoms start, how did they start, what was the severity, what is the severity now, how did they gradually move. So you forget all about it and you just go to doctor and you just say, doctor, I think I suffer from plantar fasciitis and I need treatment for that. So that just loses the objectivity. And of course, as a doctor, if doctor is me, of course I'm going to believe you, because I believe in believing patients a lot. Yes, I will explore your history. Yes, I will examine you, but I will try my level best not to negate you. And then whatever you have got in your mind, if I negate that and if I come up with something else, of course it will take a lot of my energy to convince you for that. I will do that if I think so, but again, the doctor also loses the objectivity in my mind, because if you're telling me that you've got all the symptoms of plantar fasciitis, you might just, even after Googling, for example, plantar fasciitis has 2 symptoms, but the Google tells you 6 symptoms, you might just your mind just might trick you in thinking that yes, I've got this as well and that as well. So you would just exaggerate those symptoms, or you would just add on those symptoms which fulfill the criteria of being plantar fasciitis, and then you will actually convince your doctor that this is plantar fasciitis and I need treatment for that. Plantar fasciitis is a very naive example because it's nothing that, if you're treated for it, you will get harmed by it. But this is what I'm trying to tell you, that how human mind can trick one. Then again, the other thing that I really get concerned about is if I give medication to a person and then they go home and they Google the side effects, and then they come the other day and next time whenever they're coming in and they say, oh, we haven't started the medication because it tells me that my let's say my potassium is going to become low, or my kidneys are going to fail and stuff like that. See, in that case scenario, yes, doctors can definitely make mistakes. Doctors can definitely not know about the side effects. Doctors can definitely make mistakes while, like, for example, if you're 3 to 4 medications, and they can definitely make mistake in calculating the interactions. But having said that, if that's the case, then go if you have concerns about it. So for example, I've seen a patient today, and finally I have come up with a diagnosis of, let's say, high blood pressure. And because I'm concerned, I've just started the patient on a tablet, and the patient is now about to let's say follow up with me, let's say next week, because I usually, if I start a patient on a medication, I would like to see them in a week or 2 weeks time. So if the patient is coming, so I've seen him on a Friday, and then he's coming back to me on next Friday, but he goes home and then he Googles that medication and comes up with the side effects and is not happy with it. And he still, for the next 7 days, he sits on his high blood pressure and is not doing anything about it just because he's worried about the side effects. My concern is, if that's the case, then please contact your doctor ASAP. Please contact the practice ASAP. Make an urgent appointment with your doctor. Go and see them, because you're already so late in starting your medication, and now that you have started and you're not going to take it, then again, as I said yesterday also in my video podcast, that high blood pressure is a silent killer. So you just do not want to waste any more day in starting the medication if the doctor has already given you. So please make an urgent appointment. Go and see the doctor, express your concerns there and then the doctor can clarify for you that whether your concerns are correct or incorrect. So again, this is like, as I said, everything has pros and cons. It's good to be aware of the side effects, but it's, on the other hand, if you do not go and consult your doctor ASAP, then you are delaying your treatment, which also is very, 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 very important. So I've already spoken for about 8 minutes. So in the next video podcast, that would be on pros and cons of Dr. Google and Dr. TikTok, I would try and read the articles for you. See you then.